Hello everyone, Trina Baker here. For my video for the breathing discussion, I have decided to focus on the type of breathing that we do when we sing or make a speech. I thought this would be especially applicable for myself because sometimes I get stage fright. Not every time, but sometimes when I have to speak or sing in front of a bunch of people. So I thought this might be, killing two birds with one stone, know yourself type of a thing. For the type of breathing that you do when you're making a speech, like in front of people, the big part is you're going to have enough air to project your voice more. So your body is going to need to be in an upright position, either sitting up or even better standing, because that increases your lung capacity so you can get more air. And while you're speaking, extended steady utterances is how they put it in the book. Usually you're breathing in or inhaling inspiratory breaths, I believe the way they put it. You're taking deeper breaths and you're letting it out slowly, so your exhaling or expiration is going to be slower because you're letting it out for the words. You're trying to use the air to make all those words, and it's going to be slower, whereas your inhaling is going to be quick because you want to talk more. In the instance of making a speech, more so than just regular talking, you may have to take in more air to project your voice louder, and your utterances may not be quite as long because you may have to use up more air to get that volume. The velum or velum, I'm not sure how to pronounce it. It's basically the soft palate. That will be moving around when you are speaking, as opposed to if you're just breathing for life. Especially when you make certain sounds, like the nasal sounds, and they'll bring it down, and then it'll go up more when you make sounds like k, and you can feel it in the back of your mouth when you do that. But if you're just breathing to live, it just kind of sets. And then high drive, that's when you have to breathe more to catch up with the demand. It depends on the person for speech. If you're super nervous or you feel like you're in a rush and you're not calm, then that can become a high drive situation where you feel like, and then you're just kind of rushing through what you're saying, and then you have to gulp for some air to continue. If you're calmer or better at disguising it, you may not be gulping for air quite as much. So it might be a little closer to normal speech than, say, if you just ran a race and you're just like, yeah, that was a good race. Again, that would depend. Some people are that nervous. I've been that nervous on a few occasions. Where it is kind of a high drive and you have to kind of talk yourself, I am okay, I can be calm, I need to breathe normal. In some instances, you would be breathing through your nose, but that's usually more for effect. Like if you say something and then you're just like, it's just kind of like for the effect. But usually when you are speaking and doing things for like speech or singing, you will say your bit, usually a sentence. It's usually divided grammatically or cognitively by like thought. So you would take the breath after it makes sense to take it, unless you timed it wrong and you need to catch up more air. And that's more like a high drive thing again. You ran out of air because you didn't time it right. The part that I thought was the most interesting, though, was how our breathing patterns will change based on what will make sense. For sentences or to complete a thought. So I thought that was pretty great.